Hi, good afternoon, Doc. How are you again today?
I'm good. I'm good. Thank you.
Awesome. So this is our second series of a video for Hey Doc series. We're going to be concentrating on restless leg syndrome, which is not widely known. And you mentioned you have a chapter in your adrenaline dominance book for restless leg. And it's only become aware of RLS to me since I've got married and my husband had restless leg. So anyway, I'm excited for you to share this because we did your protocol with my husband and it worked. So, but first of all, describe what is restless leg.
Well, in essence, it's basically what it sounds like. The legs feel actually uncomfortable, and that's a hard feeling to describe. But it's just they're uncomfortable, and people are sort of forced to move their legs around, trying to get some relief. Now,
Like
people have to.
involuntary movements of your leg or?
Well, or voluntary. In other words, they're just trying to get some comfort. It's a very uncomfortable feeling, basically what it
Is it
is.
painful?
No, not necessarily. No, not necessarily painful. But you know, the thing about adrenaline, it does affect the lower, the lower legs. You know, when you see somebody sitting in a chair and their knee is going up and down, that's adrenaline.
Yes.
And you know, when people get cold hands and cold feet, again, that's adrenaline because it cuts off circulation to areas of the body not needed for survival. But but along with restless leg syndrome, a lot of people get cramps in their calves and their feet at night, which is can be extremely painful. And this is also adrenaline. And so the thing is that once people are aware of what is causing a problem, you can actually eliminate it. Right now, the basic treatment for restless leg syndrome is they give patients anti-Parkinsonian drugs, and I can tell you unequivocally these drugs do not work. But
what is that drug typically for?
Oh, for Parkinson's disease.
Really? Wow.
Yeah.
Interesting.
And yeah, but the problem is, the doctors they treat symptoms, but unless you treat the cause, you cannot eliminate the problem. Now, if you know that adrenaline is the thing that's causing restless leg syndrome, then the hormone that you use to treat it is progesterone, because progesterone blocks adrenaline. And what's interesting is that you take the tube of progesterone cream and you put one pump on top of each leg and massage it into your thighs, into the top of your thighs. And in about 30 seconds, the restless leg syndrome is gone. And let me tell you something, what's nice about treating the cause of a problem is that people get better. And that's let me tell you, it's very rewarding to, to improve the quality of life of people. And the other thing is that when people have cramps in their calves or their feet, you can also massage progesterone cream wherever the cramp is. Now, it doesn't go away in 30 seconds. Sometimes it takes a few minutes, but it will go away. But let me tell you something, these cramps are severe and they're painful. And I don't know of anything that treats the cramps better than a 5% progesterone cream does. So
that's incredible. Now, not everybody with RLS has cramps. They could just have movements.
Right. You don't have to have both, or you could have one or the other, but people should be aware that there is something they can do. Now, usually though, when people have restless leg syndrome or cramps, they have other problems related to excess adrenaline. So, progesterone is great because it blocks adrenaline, but when it comes to adrenaline, the primary approach is to lower levels of adrenaline. And in order to lower adrenaline, you have to approach it from the reason why the body is releasing adrenaline. And, and I talk about this a lot in my book called Adrenaline Dominance, but, people have to be aware that in order to reduce adrenaline, the primary approach is nutritional, because the reason why the body is putting out adrenaline is just simply to raise sugar levels for the brain. And
Right.
most people don't realize that the brain uses more sugar than any other tissue in the body. And anytime the body detects a drop in sugar in the brain, it puts
Right.
out, adrenaline to raise sugar levels.
Right. I
Yeah,
remember when I was younger, my dad used to say, "Oh, sugar's good because it feeds the brain." But he was
yeah.
eating sugar cane sugar. This was like 20 years ago, and they weren't as into nutrition as we are now. But
But
I
let me,
know you have a meal plan that we just developed last year that actually works well with an adrenaline dominance program that feeds the brain through vegetables and coconut oil, and you have some really good recipes. So that is something that you recommend to manage adrenaline along with progesterone cream, to manage adrenaline.
Yeah.
So when you, especially before you go to bed, I know you had mentioned something to eat to feed the brain, because at night you can wake up, your brain uses a lot of energy at night. So talk a little bit about that.
Well, the brain actually runs out of fuel about every 3 to 4 hours.
Right.
But but the time of day that the brain is almost devoid of nutrition is around 2:30 in the morning. The brain is out of fuel. And so needless to say, adrenaline levels are highest at that time. And adrenaline gives people that urge to urinate. So people will notice that right around 2:30 in the morning, they do have to get up at night to urinate.
Right.
During the day, they talk about an overactive bladder, for women,
Mhm.
but that's adrenaline also.
Incredible.
So,
Right.
but if people are interested in adrenaline, I think they'd find my book interesting.
Well,
Adrenaline Dominance is the
yeah,
only book ever written that actually talks about adrenaline and the clinical consequences, which is
well,
very surprising.
it is
You know,
surprising.
Well, because, when you consider the number of conditions that excess adrenaline causes, how has it gone by the wayside of medicine for
It's
forever?
incredible.
Because, I mean, but people, again, have to realize that the medical system is not there to get people well. It thrives on disease and
And like you
illness. It
said,
doesn't,
most doctors do not get, they don't have training or need training and hormones to get their license. So not many doctors are knowledgeable about it. And
yeah,
so I think just your years of dealing with patients and hormones and relating the two together through observation and treating thousands of patients, realizing that with progesterone, the benefits of balancing your hormones also helps with other symptoms, and piecing that together is, huge. It is really it's groundbreaking.
yeah.
Well, anyway, we have there's so many things. We're going to take little snippets, and right now this is a very interesting topic. I know that my husband was having not cramps, but involuntary leg movements at night, like every 15 seconds. I couldn't get to sleep. I grabbed the progesterone cream. I remember reading it in your book, and he was kind of halfway asleep, and I rubbed it on the back of his knees, and that was it. It was done. I mean, and so we keep it in his little nightstand. So before he goes to bed, he puts it on at night as a routine. But it was incredible how easy and how quickly that this remedy worked. And it was just, you read things and people tell you things, and then tell you experiencing them or hear other people having that testimony, which is, one of the reasons why we want to have this podcast, is talk about some of the common questions that we get from people and what we experience. So we have a ton of reviews also on our website. We have more information in this topic on in your Adrenaline Dominance book, which is available in paperback and digital format. And also you can email Doc directly at questions@Platt Wellness. And there's a ton of information, a ton of blogs on our website. So please inform yourself. And let us know if you have any questions. And thanks for joining us, Doc. Thanks again for your time. And
Always a pleasure.
okay, until our next time, and we will see you shortly. Thanks, Doc.
Okay.
Okay, bye.